Okay, so today we're going to do our Beginners Series number 3 session, and we're going to focus mainly on segmental mobility of the spine. So we'll think looking at the spine and how it moves. So the spine is made up of the neck, the cervical spine, around the ribs, the thoracic spine, the lumbar spine in the lower back, and then the sacrum and the tailbone are fused bones. So they kind of move together. Whereas the rest of the spine, each vertebra moves on the next and on the next and on the next, or it should. Now, what often happens is people get very stiff in their spines because the external muscles become very tight, and we need to be able to get each segment to move on its own. So we need the external muscles to release and not be so active and tight, which is often why you can get back pain, and get the deeper muscles to start working and moving. And that's what really helps with any back issues and problems. We get the deep core muscles of the spine stronger and mobile, and we get the external muscles a little bit freer, a little bit more flexible, and maybe stronger as well, depending on what you need. So let's have a look at some exercises that we do in Pilates that are going to really help with your spinal mobility. We may have covered a couple of these, but we're focusing on moving the joints. So come into your all fours position. Hands under shoulders, knees under hips. You're going to really push away from the floor with those hands and let your tailbone lift. So this is our cat stretch. And we go from this neutral position, there should be a slight curve in the low back, into the full C curve of the spine, or the cat. Knees are under the hips. Your tailbone is lifted slightly. So there should be this natural S curve to the spine. Tuck your chin, look between your hands. Now breathe in to prepare. And remember, we've talked about how we let the tummy release. We let the ribs lift on the inhale. And on the exhale, I want you to think about lifting your pelvic floor, tucking your tailbone, drawing your belly button towards your spine, and slowly, segment by segment, stretching across the top of the back and stretching out the joints. Chin into chest, breathe in, and then slowly return. Look between your hands, slowly release the upper back segment by segment and bring it back to neutral. Tailbone lifts. Inhale. Try that again. So we want smooth, flowing movement from the bottom of the spine to the top of the head. Tuck the chin, look through. And then slowly return. So feel each part of the spine. And this can be quite tricky in the upper back to bring it all the way back to neutral. Inhale, let's try one more. And this is a lovely way to warm up as well. And this is a great exercise if you're suffering with any back pain or any problems with your back. This is a nice way to not put any gravity through the spine. All the way back to neutral. And then a nice relaxation position is our shell stretch. Take the bum back to your heels, reach your arms out. Take a couple of deep breaths into the ribs. And again, deep breath in and out. Good. And then slowly, I want you to restack through your spine. Okay. Now let's try another mobility exercise for the spine. We're going to come into sitting, straighten out the legs. Now if you struggle to sit up straight because you've got quite tight hamstrings in the back of your legs, you can soften your knees a little, or your other option is to sit yourself on a block, okay? Now we're going to do a spine stretch. So when we're spine stretching, we want to round the back, so stretch the spine, and then reach forwards with the spine as well. What we don't want to do is scrunch down and compress the spine and then try and go forwards. So I want you to bring your arms up to about chest height. I want you to practice first of all the little scooping out of the spine. So breathe in. I want you to tuck the tailbone, scoop out the tummy, drop the head down to look towards the thighs. Head is between the hands. Now palms can be in or forwards. And then flex your feet activate your legs and try and keep the curve in your spine as you reach forwards towards the toes. Now don't drop your arms, keep them at shoulder height. Imagine they're sliding along a shelf. And then restack the spine. So think about the spinal segments like Lego bricks, restacking one on top of the other. And then sit tall, shoulder blades down. Breathe in, sit as tall as you can. You should have that nice straight spine. Then scoop out the tummy, drop the ribs, drop the chin, hold it. Then reach forwards. Press the thighs, pull up with your toes, hold it. Deep breath in. Bring it back. Segmental. Up, 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 up. Lengthen, look forwards. Tuck your chin. Remember that neck is part of the spine. Don't let it poke forwards. Inhale. One more. Scoop it. Drop. Then keeping that tummy. Imagine there's a beach ball here. Reach over it. Go forwards, forwards, forwards. And then restack. Lift up your arms for me. Bring them around. Let's stretch out the front of the body now. So hands behind you, fingertips point away. Draw your shoulder blades down and lift your chest a little. So a nice big shoulder and chest stretch. Lifting the breastbone. Opening up the front of the body. Good. One more. And release. Good work. Now, another focus for spinal mobility isn't just flexion and extension, which is rounding and arching the back, but rotating and side bending as well, which we've done a little bit already if you've done the previous sessions. But let's review our rotation in our upper back because that's a really important movement. So you need a block or a couple of pillows under your head, and let's look at our arm openings. Okay, and we're going to focus today on the ribs rotating and really thinking about the spinal segments moving around like a spiraling staircase. So stack your arms, knees are bent up, ankles are in line with the hips. That brings me into a neutral spine position. Now, if you're unsure of this exercise, just watch one. We're going to reach forwards, stretch past the bottom arm. This is surrounding the shoulder and stretching. Then follow your arm. So I'm tracing my arm. You can even touch your arm. Go across the chest and pop your fingertips on your rib cage. Now breathe in here. I want you to gently rotate the ribs around. So I'm trying to bring my chest towards the ceiling and then extend the back arm. Hold it. And then reverse that. Bring the hands to the ribs and follow it back. So have a go. Breathe in. Big reach forwards. Breathe out. Now keep your knees together. Keep the core engaged. Remember we talked about drawing the belly button in. Now breathe into the hand. On the ribs, gently ease it round. Draw your tummy in. Hold it. And return. One more. Reach, big stretch. This is lovely for upper back and neck mobility. Bring the hand to the ribs. Breathe in. Bring it round. Extend the back arm. Deep breath. And then return. And release. Good. Now transition before we do the other side. Let's look at our bridge exercise again. So spinal mobility. Feet can be under knees, okay, or slightly further forwards, whatever you prefer. Feet and knees about hip distance apart. And find that neutral spine position. We're looking for the little gap, but the ribs are down. So again, segmental movement. This is about flexing through your spine and peeling off segment by segment. So segmental control again, just like the cat stretch. Reach your arms down towards the heels, palms on the floor. Breathe in. Imprint your back. So when you imprint, you should flatten out. The sacrum comes into the floor. Now start to peel the bottom off, and you should feel and imagine each vertebra just really slowly peeling off. So segment by segment by segment, smoothly up towards your shoulder blades. Now don't go past the shoulder blades, and keep your rib cage gently down. So I'm not doing this, I'm not flaring up into that type of bridge. We want the ribs down, the bottom tight, and then smoothly back down. And replace those vertebrae, make it as smooth and as controlled as you can. Then let your tailbone release, let it go back to neutral, take your breath in, and repeat. You blow out the air, you peel off. Think about the vertebra like a string of pearls. Breathe in, really squeeze your bottom, and breathe out. So this posterior tilt, this is called, is the most important part of the bridge. Being able to tuck the pelvis and imprint. As we go the other way with the pelvis, this is an anterior tilt. The arching of the back. One more. Breathe in. Imprint, squeeze the bottom, really stay tucked, feel the spine peeling off the floor, hold it at the top, and then down. Feel the back of the ribs, feel them come down, 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 and release. I want you to try one more, but I want you to add some arms to this. So breathe in, our arm pullovers. Let's let the arms come up as we lift the hips. So I let my arms float up and overhead. Now what's key here is as your arms come to the floor, I want you to keep the rib cage down. So don't let the ribs pop up like this. Arms go over, ribs stay down. Now breathe in. And then keep your arms here and slowly melt down. So replace the back of the ribs, slow, slow. Lengthen through the spine as you do this. All the way back to the tailbone. And as you inhale, let's bring the arms over. Let's try that one more time. So this is really nice for lengthening and lowering through the segments of the spine. So we come up, the arms come over. Don't lift your ribs, breathe in. Let's smoothly go back down, vertebra by vertebra. All the way down. Neutral, inhale, arms, and release. Good. Give your knees a hug and just gently massage out that lower back by circling the knees and back the other way. Let's do our arm openings. Okay, side lying arm openings on the other side. So move yourself or turn yourself over. Bring your block back in and set yourself up here. So my head is at the front of my block, my hands are stacked, knees bent up. Remember, you should have a quick check that your back is in neutral so you can feel there's a little curve there. From here, relax the shoulder, reach it forwards. Now trace the arm, come across the chest to the ribs. You should feel the bottom of your rib cage, breathe into it. Now follow your arm behind you and extend the arm if you can. Take care if you've got any shoulder issues. And then return hand to ribs and gently back to where you started. Let's have another go. Reach forwards, a nice big stretch in the back of the shoulder. Breathe out. Follow. Bring the hand to the bottom of the ribs, look to the ceiling. Now breathe in, feel the breath come into your hand. And then follow it round. Extend the arm. If you can get to the floor, go for it, but don't force it. Inhale and exhale back. One more time, let's do this. Reach forwards. Bring it back. Hand to the ribs, breathe in. Ease it round. Think about trying to get the ribs a little further than last time. Knees stay glued together. Straighten out your arm, deep breath into it. And bring it back. Good. So this is a lovely everyday movement that you can do. We tend to get very stiff in our middle back rotation because of all the forwards work we do and flexed work. So it's a really important movement. Now let's transition onto the front next. We don't just want to be able to control the spine in flexion or rotation that we've already done, but we want to be able to control the spine in extension as well, okay? And we can extend the back in several ways, but lying on your front is a good way to do this. Now, if you've got a little block, pop it underneath your forehead. We're going to just do our upper back extension and then we'll progress into the lower back. So you lie on your front, forehead on your block, legs are relaxed about hip distance apart. I don't mind what you do with your legs, but we also throughout, we want to think about lifting the belly button. So I want you to just practice, first of all, breathing in. And as you breathe out, I want you to just draw the belly button up towards the spine. What we're not doing is this, tucking the pelvis under. Okay, we're not getting that movement. This is just a drawing up and tightening. So watch your back isn't moving, you're just lifting the belly. So breathe in, breathe out and lift that belly as if there's a pin under there and you don't want to touch it, or an ice cube. And again, one more. Now I want you to think about keeping that belly lifted on these exercises. Arms in a W on the floor, okay? So if you're not sure about the angle, I'm going to just maybe turn myself slightly so you can see a little bit more here. Okay, so we're here. We're in a W. This is what we're going to do. We're going to slide the shoulders away from the ears. The tummy is on. We're going to hover. Don't put too much weight in your hands. Just hover the head and breastbone. Feel the slow lifting of the spine and then the slow replacing back to the floor. Okay, let's have a go. Slide the shoulders down, hover off, think about the tummy, breathe in and lower. And again, shoulders, tummy, hover. Keep your focus on your mat. Your neck needs to be in line. Good. Now see if you can lift a little bit higher. This is very individual. So this is about the segments further down the back. You lift the head and breastbone and then we progress. So we lift the tummy more. We squeeze the bottom a little and we start to come up into a full back extension or a full swan dive position. And then we lower smoothly back down. So this is about extending the segments of the spine with control, no hinging. So shoulder blades, tummy tight. This is why we need the tummy. You want to lift the tummy, squeeze the glutes to support the lower back. You come up. Now your focus comes slightly further forwards because your neck needs to stay in line. And you might not be able to get very high. Just lift as far as you can with your back right now. One more. Shoulder blades, they need to stay down. Elbows, they need to stay in. No flaring elbows. Draw them down and in. Keep the length in the front of your body. Breathe in at the top. And blow out the air as you go down. All the way down. And relax. Good. Now come up. Back up into your shell stretch position. Come back towards the heels, reach your arms out, or just stack the hands and pop your hands on them. Take a couple of breaths, in through the nose and out through the mouth. Now let's come into kneeling and do a little bit of side flexion. So another thing we need to control is the side movement of the spine. So When we kneel up in Pilates, we still want good alignment. So I'll show you from the side. Knees under the hips, so we don't want to be back here and we don't want to be here. We want to squeeze the glutes a little, engage the core, so lift the pelvic floor, draw the tummy in. Arms at your sides, so little squeeze in the shoulders, reach your fingertips down the sides of your trousers and tuck your chin in. Breathe in. Now do a little side bend, reach down towards the floor, feel the waist, squeeze on one side, lengthen on the other, lift back up. You are imagining you're between two panes of glass and they're really close to your body and you don't want to touch the front one or the back one. You're just in the middle, sliding sideways. So no flexion or extension of the spine, just side bending. And again. And lift. Breathe out, keep the core engaged. So you form a nice smooth curve in the spine. What we don't want is kind of a hinge in the spine on one joint. Now to progress this, we could add an arm. So if you want to, we can lengthen over with one. And you've got to work your core. You feel you've got to work quite hard to hold it. If you don't feel ready to add an arm, you stick with the side bending with both arms by your side. Reach down. We want both sides to be even. So if we're a little bit tight through the low back, it may feel difficult. Try this one, last one. I want you to bring your hands to the back of your head. Squeeze your elbows back, drop your shoulders. Now again, watch out in this position that the ribs don't come forwards like this. I want you to drop your ribs down. Inhale. Squeeze the tummy, squeeze the glutes. So we've got nice tight core, but we need to breathe down as far as you can. Inhale. Lift. Let's do one more the other way. Slide down. So we can really play with side flexion and lift and release. So side flexion doesn't just stretch the waist, it works the waist muscles as well. So it's a nice combination move and we don't tend to stretch the sides enough. So let's do one more segmental exercise for your spine. And this is our roll up or roll down from the floor into standing. So if I show you this one, we're going to come into our crouch position if we can, and then straighten out the legs a little bit. So soft knees, feet hip distance apart. Now I want you to lift your tummy, scoop your tummy up, release from the floor and slowly restack. Nice and slow, all the way back up to your set position. So your feet are under your hips facing forwards. We're going to go down again. So it's about segmentally flexing the spine. So you drop your chin, you drop the breastbone, you bring your weight into the fronts of your feet a little, ribs down, knees are soft. Slowly, slowly. Now, if your back gives you problems, you don't have to go all the way. You could stop here. Really draw the tummy in. So you're creating this rounded back, like the cat stretch position. If you can get to the floor, go for it. And then roll back up. Arms are heavy. Lift into your pelvic floor. Restack through your spine. Now, a nice way to do this exercise is to stand against a wall. So if you can, find yourself some wall, okay? Stand against the wall. I'm not going to do it here, but I'll just show you. Bring your feet as close to the wall as you can. Now, you don't want them touching the wall completely because it becomes too difficult and you'll probably fall on your face. So to start with, a little bit away from the wall. Then bring your shoulder blades back. Tuck your chin so the back of your head touches the wall. Breathe in. Let's try this one more time. You drop the chin. You drop the breastbone. You drop. Now tummy tight. Lift up the belly. Bring the weight into the fronts of the feet. So we don't want the weight in the heels. Keep slowly, smoothly lowering all the way down. Stay there, breathe in. Now as you breathe out, lift the pelvic floor, scoop out the tummy and slowly restack. So this is all about segmental control movement. You would never bend down like this to pick something up but this is a nice way to work on the control of movement of your spine, okay? So standing, flexion and restacking is a really good exercise if you're at that point. If your back is a problem, halfway or roll down from sitting. Okay, let's finish there with our segmental work for the spine. I think there's a lot to be working on and thinking about. And we will progress on some of those exercises in the next couple of sessions as we add some more upper and lower body to the spine. So let's just finish off, feet under the hips, facing forwards. I'd like you to take a nice deep breath, lift your arms and circle them around. And again, one more time. Inhale up, exhale down, and just relax. Thanks a lot everyone, and I hope to see you again for the 4th session in our beginner series.